Welcome back. Well, Breastlink Laguna Hills, we're happy to have them on today. They sponsor our Monday show, and today we have on Dr. Lisa Curcio, who you certainly know. She's a surgical oncologist with Breastlink. And please introduce your guest. I haven't met her before.
Yeah.
No, we have Shirley Witt here with the Florence Sylvester Senior Center. Nice to have you both here today.
Thank you very much.
And first of all, Doctor, what we're really talking about today, and we're going to talk to both of you about this, is the new American Cancer Society guidelines on mammograms and age. There's always a lot of different opinions out there and rumors and things like that. So let's go through those and how it progresses, because obviously we start at 55 in this community, how it progresses from 55 to maybe as you get to even 90 or 100.
So I think the one word I could use to describe all this is confusing.
Yeah,
and it's not only confusing for patients, it's confusing for providers too. I mean, I literally had to write down the different recommendations from the different societies because they're different. And I think we're confused as providers. Sometimes we're giving misinformation to patients, and then patients are so confused that they do nothing. And that's the last thing that we want to do, because we do know mammograms save lives. And I think if nothing else that people walk away from today's show, mammograms still save lives, and none of this is new data, it's just rehashing of old data. But that being said, the task force came out in 2002, and then they updated their recommendations in 2009, and essentially they said we should be having screening every 2 years, starting at age 50 to age 74. And then women between the age 40 and 49, that should be a shared decision between the physicians and the patient, depending on the risk level and the patient's concerns, okay? They did not make recommendations for patients over 75 because there are no studies looking at that age group. They did not say, correct, because all these studies are screening studies, so they chose a cutoff date age, and that was 75. So they did not say don't do screening at 75. They just says that there's no data to make recommendations on the age group 75 and above. So that's the task force. Remember, that's a government-run task force. They're making recommendations for population screening. The American Cancer Society initially had a lot of problems with those initial recommendations. More recently, about a month ago, came out with recommendations, and they feel very strongly that there is a huge benefit in the mid-40s to mid-50s of mammography. So they recommended yearly screening from ages 45 to 55. In women younger than 45, between 40 and 44, that should be shared decision making, similar to the task force recommendation. And then after the age of 55, it should be every other year they recommend it. And they recommend it continuing until a person's life expectancy is less than 10 years. So they did not recommend cutting off at a certain age. They just said there's not a lot of data to make recommendations over 75, but as long as your life expectancy, you don't have lots of medical problems that would shorten your life, as long as your life expectancy is 10 years, you should continue to get every other year mammography.
Okay. Shirley, one of the reasons that you're here today is because, of course, the Senior Center has a lot of programs, many kinds of programs that you offer there. And I know you're going to be working with Breastlink coming up. But you've often said, you and Cheryl, that if you have questions about things, we can point you in the right direction. You've vetted a lot of different, from financial to health, everything. And you hear from a lot of women, particularly over 70, that maybe I don't need to get a mammogram as often, or maybe not at all anymore. I'm over 70, I don't have any problems. And that's why you're here today.
Well, that's why I'm here today, to have the doctor talk to us about, what we should do and shouldn't do, because as you know, the Senior Center prides itself on educating the seniors of the community, and we have a lot of good health and wellness programs. And when the idea of cancer comes up, or breast cancer in particular, we have a lot of seniors saying to us, well, my doctor, and maybe the senior is 70, 75 years old, says, I don't have to have a mammogram anymore after 70. And then the issue also has come up that about men. Men always say, well, men don't need mammograms. And what is your take on that, doctor?
There are no guidelines to mammograms in men unless there is a family history of male breast cancer or a known BRCA mutation. But certainly men should do breast self-examinations.
Okay.
So, as you said, Ken, the Senior Center is a great resource for the seniors, and they come here, and we have partnered with BreastLink because of your great reputation and the good work you're doing in the community, and we want a resource that when our seniors come to us and have a problem or have questions, we want to send them to the best of the best.
Yeah, and I can understand why this is confusing, because on the male side, you worry about colonoscopy, as you should with women as well.
Absolutely.
Right.
But that changes. I mean, just in the last few years, the guidelines for that has drastically changed. So I can see with all the different societies and associations out there that you hear different things. They all have intentions, but as one gets older, especially with women, when it comes to breast cancer, is it more of a chance that they could have that? Do they need to look, obviously if they look at their history, and they see
and
this,
all of this is based on an average risk woman. If you have a family history, or you've had multiple biopsies, or you had your children later in life, or were on prolonged hormone therapy, all of those are risk factors that these screening guidelines do not apply. So it's for the woman who's at average risk.
Yeah, and that's a good point. They're guidelines.
Exactly.
Yeah.
There's something to kind of be a benchmark. If care's not being at least at this level, it's below what would be considered the standard of care. But they're not written in stone. You do have to individualize depending on the family history.
Do you feel that one's primary care doctor, that maybe they're reluctant to send women to mammograms or to specialists and all, not because they aren't caring, but because, okay, there's an additional cost to you, or deductible and things like that. You often hear the backlash against over-testing, over-medicating, things like that. Do you think that's part of it as well?
A couple things. I think of a couple of very good points. Number one is, cost is going to be an issue. Insurance is very expensive nowadays, and deductibles are higher, and co-insurances are higher. So that definitely. And as we move more into a managed care environment where more and more patients are under a managed care organization, there's going to be more push to the primary care doctor to limit those referrals to specialists and to limit to a certain degree testing. And that's where patients are going to get confused because when they're in this managed care organization, they don't have access to this. But if they come out and go to a PPO, then they're going to have access to it. So it's very confusing to patients outside of the guidelines, what different healthcare organizations will allow them to do. So I could just say one word, it's confusing. I know the American Cancer Society came out with these recommendations because they really wanted to make the point that annual screening in that 45 to 55 year group, it was very important, but I think it's just added another layer of confusion. And when people get confused, what they do is they don't do anything. They just kind of go the path of least resistance.
Yeah, and I know you've had a lot of seminars at the Senior Center with different medical groups and things like that. One of the changes that I think I've seen in the positive side is what they call wellness, meaning that they are promoting, get your mammograms every year. Just as I was talking about colonoscopy, every time that I'm scheduled to have one, something gets sent out to me 6 months in advance. We want you to go do this. There's not going to be an extra cost. Let's face it, in the long run, it costs the insurance community and the medical community less money to keep you well, right?
Absolutely, absolutely. And that's what the seniors of this community are very savvy. They want to be educated. They want to know what's going on, and it's very important to them. And that's why, we partnered with BreastLink because it is important. It is important to have preventative health care. But it was also important to take care of our 80 and 90-year-olds.
Absolutely.
And people sometimes the doctors, they have, our seniors have come to me and said, well, I'm 85 years old, and the doctor says that I don't need to worry about that anymore. I'm 85 years old, but they do worry.
Yes.
And I think that's wrong. And I think
Well,
that's wrong.
and that 85-year-old may well have had a mom who lived to 105.
Yeah,
Exactly.
So that's just a number at that
Exactly.
point. So a couple things that are important. We know that the risk of breast cancer increases as we get older. That's so important. And 26% of breast cancer deaths occur in women over 75. And still, mammography is the best test to detect breast cancer. And if it's detected on a mammogram only before you could actually feel it, the chance of cure of breast cancer is over 90%. So those are important statistics for people to understand. If you're going to live another 10 years, you should be getting your mammogram. Maybe not every year, maybe every other year, depending on what you and your primary care provider decide. But it is important to understand the statistics.
Yeah, very good.
That's very, 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 very helpful.
I know
very
since
helpful.
you're partnering with BreastLink now, are there going to be some seminars that come out? Do you have
Absolutely.
anything scheduled
We're
yet?
going to be, we're scheduling for 2016. We're going to
Okay.
have several seminars. BreastLink's going to be in our health fair. They're going to be around because I truly, truly believe in what they do. They're saving lives. They're saving lives, and that's the kind of people that we want to partner with, is people who take care of the seniors of this community.
Well, it's great to have you both here today. Doctor, always good to see you.
Thank you.
And always good to see you as
Thank
well.
you, Ken.
So I want to thank you. I do want to mention, because you're not going to be on until next week, as
That's
far
right.
as the Senior Center. They're doing their Thanksgiving luncheon on next Wednesday?
Next Wednesday, the 26th.
Okay.
So please call the Senior Center and make your reservations,
Yes.
because our holidays are very, very busy and we only have room for so many.
Yeah,
so,
it goes
and
quick.
I hate turning people away on the holidays.
And we won't
so
see you until the day of.
I'll be
so
here
we wanna
next
mention
Wednesday,
that.
right.
Good to see you.
Thank you.
All right.
Thank you.
BreastLink's number, they're right over here in right by the Laguna Hills Mall, or whatever it's going to end up being called. We don't know yet, right?
That's right.
As they go through their changes. 949-770-0797. Nice to have you, and we'll
Thank
be
you.
right back. I think it's going to